This is the Transformative Vertical Flight meeting, September 2024. And we have today a speaker from Europe, Dr. Petri Mononen. And Dr. Petri is principal scientist and VTT leader of unmanned aviation.
Somebody's mic is on. There's feedback.
So he has. It's still on. He has been involved in many research projects, unmanned aviation related.
Is it the note taker that does the echoing?
Yes, indeed. Now it's better. Now it's working. So now it's working. So Dr. Petri has been involved in many unmanned aviation related research. His expertise includes innovative air mobility and large-scale national and international project lead. He has been the coordinator of several EU projects and also SESAR projects. He's also a member in the program committee, project delivery committee, and governing board. He will present today his finding in one of recent coordinated projects, namely AiRMOUR, enabling sustainability air mobility in urban contexts via emergency and medical services. He will present us our challenges and obstacles for the future scaling up of the innovative air mobility. So, Dr. Petri, floor is yours.
Okay, thank you for the kind introduction. Nice to be here. Hopefully this sharing goes well. I would like to share a short video also and with the sound. So I don't know whether that, because I included sound, whether that screwed up the audio just a couple of minutes ago. But let's see. I'll share now first without the audio. So hopefully that goes better. So please tell me if you can see my screen. You can. Okay, very good. So I'll start. My first time visiting this working group and the entire constellation that you have done there, I didn't have time to get really deep into the contents of it, but of your work. But looking at the contents of the working groups, at least the work done in AiRMOUR seems quite valid from that point of perspective. So let's crack on. So many of you probably, I'm sure which organization each and every one you are representing, but I'll tell just a couple of words about the VTT to start off, and then go into project finding, so that you know that which kind of organization we are. Marilina already presented my sort of position here at the VTT, so leading a research team on innovative air mobility and on the side doing quite a bit of project work as well. So the SESAR, once again, many may be familiar with it, but maybe not. So that's the Single European Skies Air Traffic Management Research joint undertaking with 60 or 50 odd partners from Europe, and funding the research here for aviation and also advanced air mobility related issues. So quite active there personally. So VTT, we are 2,300 about strong. We are a research and technology organization, so not a university and not a consultancy either. So working on the mid-ground on applied research, and operating in many kind of projects, customer paid projects, and also jointly funded projects, and leading quite a few innovation ecosystems nationally, also Europe wide. We do research in basically all facets of the technology. I come from the mobility and transport research area, where the drones and advanced air mobility and innovative air mobility are located. Of course, we all know that there's no really sort of only one good home base for this, because quite often dealing with this mobility, it's not about mobility, it's about a robotic platform carrying various payloads, and whether it's cameras, and then it's not about transport and mobility, but this is how we are aligned in our organization. We deal with quite a few aspects, some related to AAM, some less so, but starting from some sustainable aviation fuels, the European initiative there, also hydrogen propulsion, quite a strong Arctic expertise here at VTT, being in the north, so that's also valuable for many other regions of the world. Quite a bit of for certain reasons, quite a bit of dual use technology expertise has been building up during the past few years, and even for decades. So that's our background, and really heavy on communication, also to airborne objects, but general communication networks and technologies as well. And one of our sort of leading research items is the airspace management on the very low level airspace. So the European U-Space sort of ramp up or implementation is on our table at the moment, quite heavily, setting up those to Finland, as many other countries in Europe are, and we are quite agile in also performing live flights. So we have a fleet and pilots and certificates and things like that for that purpose. But everything we do basically is based on projects. So we have some baseline projects that operate as our funding. So this is my segue to the AiRMOUR project, final slide, before going into straight into that. So AiRMOUR has already concluded. That was Horizon 2020 Research and Innovation Action. I'll tell more about that, but there are several others. So Academia Finland, sort of at least in the US, the equivalent would be maybe the National Science Foundation, funding many of our activities, and also Business Finland, the national funding agency for technology related research and innovation and development. So quite a few of those. My main work at the moment is this STOL project, which is around 50 million in total, fully nationally funded, and we are on the second innovation stage on that one at the moment, but also commercial activity and things like that. But on AiRMOUR, so if I jump into that, so we ran for 3 years, ended December last year, and we had 13 partners around Europe from six European countries, and VTT was coordinating. I was the coordinating persons for that. We had quite a lot of research activity on desktop, but also a lively roadshow across Europe, doing actual physical flights and validating some of our findings and research hypotheses on those settings, or in public settings, and also in cordoned settings. So now would be the perfect time to show the video, but let's see how it goes. So I'm really looking forward to how this works. So maybe I stop sharing and then close my. I'll start sharing again right away. Share screen, same screen now with audio. I'll close my microphone. I'll also
What we really like is that drones can be used on a daily basis to save lives in hard-to-reach areas like archipelagos or mountains, in congested areas, or in very in congested areas or in very remote areas. But for that to really happen, AiRMOUR had to carry out a wide range of research, and we have now a lot of information to provide cities and also emergency medical services with decision-making tools and with background information on risks, for example, environmental aspects, business models. We've looked also a lot into concerns from citizens. In AiRMOUR, we've been able to test various very relevant use cases for the emergency medical services.
Citizens could be helped much faster and, frankly, live better lives.
In this special case, I think the main focus is on time. Time we can use for the operation, the patient, and time which we don't lose anymore on transportation. Therefore, the drones are a very important tool to get a better healthcare in the region.
It's very important for a city to be involved in such innovative EU projects. Without AiRMOUR, it would have taken much more time to push the drone topic forward internally. Inspired by the work and learnings from AiRMOUR, we are now into development of drafting and testing our own aspirations for Helsinki use-based digital twin.
We, the AiRMOUR consortium, are extremely happy about how our recommendations and findings have been received by the municipalities, cities, regions, and their subsidiaries. Also, the discussion and the cooperation with emergency medical services professionals and domain has been extremely fruitful and rewarding. A lot has been achieved, a lot remains to be done in upcoming years, but we've been able to establish that there's a widespread consensus that unmanned aviation and these systems will be bringing a lot of added value to the emergency and medical services.
I would like to have seen this implemented yesterday, because I can already, looking at the demonstration today, could have looked back at different cases and realized that if we'd had these opportunities, we would have applied them.
I hope you were able to see the video. I didn't see anything on the chat saying otherwise, but was it okay? Yeah, okay. So moving on. So that's the main content of the projects and the consortium. You can see on green here. So all on the Europe, even on the northern side of Europe. So Finland, Sweden, Norway, Germany, Luxembourg, and the Netherlands represented there, and 11 partners, varying from RTOs, universities, operators, and so forth. Also cities and regions represented there. Our main live validations in Helsinki, Stavanger, and Kassel, but also other activity during the project. So when it comes to this working group, there are two specific lenses that I would like to mention that were really key for the AiRMOUR setup already during the project proposal stage. So basically, we had two things that we were looking at more closely. So first of all, the role of cities and regions. So with conventional aviation, the role of cities and regions has been limited to basically looking at where the airport is and what the connectivity to that airport is from the city center and other key locations. Whereas in the AAM era, many of the cities will have to have some sort of role in defining their urban airspace with a very low level airspace. So it's not at least in Europe it's not going to be only the civil aviation administrations and their affiliates that are dealing with these issues. So that was the other lens, roles of cities in this, and the second specific role was emergency and medical services. So in the onset, we had the ambition of being able to demonstrate and fly these eVTOLs, people carrying drones, basically. We felt during the proposal stage that the emergency and medical services will likely be the first adopters of these technologies, or one of the first pioneers in using these devices for people transport for quite sort of clear reasons. Basically, these kinds of services are both politically and publicly very well approved, and they are desirable, and many of the services are, as you know, more than many others, that they are rather time critical. Quite often we are talking about human lives quite often, and the cost element, the cost critical nature, maybe not as highlighted in some of the other commercial services that are to be seen. So that was the two specific lenses that we adopted when we started the project. And running for 3 years with many work packages, tasks, and deliverables. So this kind of short presentation is more than discussing individual findings. It's more sort of I wouldn't like to say scratch the surface, but that's what it is. I'll show you what there is, and then maybe give some hints of how to maybe get more acquainted with those parts of the studies that might be of interest to you personally, whoever you are. So if I would have to only pick up a couple of the outputs from the project, I would call the Urban Air Mobility Guidebook. I will be telling a little bit more about that later, and also the UAM training program that we carried out, and AiRMOUR professionals created content and the courses and the webinars and the master classes for that, but Eurocontrol was our sort of partner in providing those trainings physically in the Eurocontrol Aviation Training Center in Luxembourg, but also the webinar platforms and other sharing platforms where those of Eurocontrol. And maybe the third main output is the live flights at the EU roadshow, to be able to show to professionals and also to some extent to the layman, to the citizens, what these devices can do, and where they have their sort of strong points. So we concluded at the end of the year in the Luxembourg Eurocontrol premises with some master classes and also the final event. So that was the main final big sort of push that the project created, and the materials of those are available still from our website, at least to some extent. But more importantly, what's available from our website is the list of deliverables, or all of the public deliverables are available there. So there were quite a few. These are reports of varying nature. In the website you can find working links to PDF versions of these reports, even the ones that on this slide say to be added TBA are there now. So this is an old picture from close to the end of a project, but as you can see, there are many angles covered by the project. So quite a lot of safety related stuff, ground safety, ground risks, air risks. Also the emergency and medical service scenarios work was quite substantial there. Then dealing with things like cybersecurity or citizen privacy, and even on the business models and the financial viability of based on the information we have so far on these things. And so far all the way to some simulated activities and the live validations, but that's a lot. So I understand that it's a mountain to climb if you only look at this list. So that is why I show only one of them to more detail. So if you want to start easy and want to get into some of the findings of the project in more detail, there are 2 documents. First, the public final report authored by me, but even more handy might be the Urban Air Mobility Integration Guidebook, which I show here. It's available in 7 European language: English, Swedish, Norwegian, Dutch, French, German, and still one what I missed maybe, but anyway, so this document is sort of a thematic summary of the project findings. So arranged under various themes, there are listed the deliverables that give further information about those. So you can find links from this report to the relevant themes and deliverables also, and there's a short description of the findings and which may give you an idea of what can be found in the more detailed deliverables that are linked to this document. I will give some couple of sort of taste bites, or what should I call it? So for example, on the kind of findings and work that we carried out in these work packages. So this is an example from work package 2, which was the emergency and medical services scenarios and use cases. We used it to define also the validation criteria and KPIs, but more importantly the testable use cases that we were going to have the live validations done to later on in the project. So we started with looking at the possible use cases, for example, divided by the type of drone, whether it's a quadcopter or smaller drone, logistics drone basically, or whether we are talking about devices able to carry people, whether it's patients or paramedics or doctors, and then we also looked at the types of payloads, whether it be blood products, medicine, medical devices, or tissue samples even, or AEDs or things like that, or then transporting patients between facilities or doctors to accident sites, things like that. So we created these kinds of use case classes, and after that, for each use case we created for the partnering cities of Stavanger, Helsinki, and Kassel, we created a more detailed description of what the minimum system requirements for carrying out that kind of operation is, and providing the key mission data and solution on one pages, like you can see on the bottom right corner. So these exist, and out of those we selected some for live validation testing to test specific KPIs and variables in our matrix. So that can be found there, and I would say that this approach, if it's found feasible and good, is easily transferable to basically any city and use case. At least those cities that took part in our research were rather enthusiastic about getting the first steps on these kinds of issues. And maybe a couple of examples from the live validation activity reasonably late in the project. So during the final year of the project, this is an example that highlights maybe some specific niches where applying AAM solutions might provide quite good benefits and outcomes financially or on the human capital. So our use case that we validated in Kassel, Germany, was dealing with a mid-sized city in the central German area, and it was dealing with open surgery. And in the Kassel example, the surgical hospital and the pathological center are some miles apart from each other, and during an open surgery, when there's a tissue sample taken, it needs to be physically transported to the pathological institute for analysis, and that with ground transport can take something between 20 to 50 minutes depending on the congestion level, and whereas with small simple drones we can do that in 5 minutes each time, every time. And that's a considerable time saving. We are talking about up to 3/4 of an hour, and all that time the surgical room is occupied. The patient is under anesthesia. The group is waiting for instructions on if and how to continue the operation. So rather simplistic use case, but points out some specific capabilities of these devices. And at the moment they are moving the test version to some sort of implementation in Kassel and in some other European cities, I'm hearing. Similarly, in the Helsinki use cases, we transported simulated the scenario where an allergy patient gets a seizure on an inhabited island, or an island that doesn't have a land-based connection to the mainland or the hospitals. And on the bottom right you can see the maps. This is the Suomenlinna Island in front of Helsinki, and we carried out some beyond visual line of sight operations, transporting the EpiPen from the mainland to the patient there. And once again, unless these devices or medicines are available nearby on the island, it may be a high-risk scenario for the patients also. These were some examples from our validation flights in the project. And just a glimpse on the other validation activities. These pictures are from many cities in Europe. So on the top you can see Helsinki and Luxembourg, where we were having a roadshow. So the good thing was that we were able to show not just the small devices, but also the bigger bird for conventional citizens, not just for professionals. So that opens up many eyes. And for the professionals, we were able to even though we were not able to fly the eVTOL, the big bird during the project due to the changed regulations in Europe during the project lifetime, we were able to have them test drive them on the ground with simulations on the screen to see how the operations and missions go with these kinds of devices, and sort of alleviate the misunderstanding that these devices would be somehow competing with the current helicopter medical services, because in reality in the short run they aren't. They are more maybe replacing ambulances on hard to reach places, but still the payload capacity and the range is smaller, and the speed is not as high as with the conventional things, but in the same time they are local emission free, and they are silent, and they spool up in seconds instead of minutes. So the response time is rather short. So we got something out of that concept there, even if we were not able to fly the bigger device, sadly. So this kind of activity, that's what we had, and lots of other data available still in the processing. So just as an example, we made a CO2 life cycle analysis, so taking into account not just the operation of these devices but also the production of motors or airframes or whatever, then during the operation phase also the needed ground infrastructure, their heating and ventilation, things like that, on the CO2 emissions, and also the end of life emissions when decommissioning the devices. So quite a lot of stuff to get into in the project. So we were not working in a researcher bubble. So we involved many stakeholders like helicopter emergency medical services, citizens, experts, and so forth throughout the project lifetime to sort of press bench some of the ideas and findings before going further. One other validation method that we use, so in addition to partnering cities and countries and partners, we also recruited a rather large group of replicator cities all across Europe and even in one in Dubai to test some of our findings and reports in their intermediate stages before finalizing those reports. So that was well-received function, and so far looking at the impact, so that's one of the keywords in the European funding framework is to create impact, and to my personal analysis, I think we do seem to be having quite a bit of impact, and first of all there was quite a lot of traction in the some of the recommendations that we provided for many stakeholder groups, including the EASA, European Aviation Safety Authority, and some of the findings have been started to take footholds in the partnering countries and regions and cities. So not just in Finland but also in Germany, Netherlands, Luxembourg, and as mentioned, things are advanced also in the ICAO front via some of our findings. And one, well, at least an impact to the research community is that the work is not done; it continues, and there's further research and development activity. Quite a lot of it visible for us in Finland, as I mentioned early on, but also in many almost all of the partnering countries and partners. They are carrying on with the work getting closer to the market, and with some use cases getting to the market already. So that's that. So when going into the challenges, at least during the project carry out phase, there's a sort of chicken and egg play going on with the regulation and also the technology development. So as I mentioned, the eVTOL we were unable to fly due to the European regulation changing during the first months of the project, and these kinds of devices were basically grounded and still are now. They are approaching once again design verifications that may facilitate them flying in other than state aviation rules or as RC controlled devices. So the other chicken and egg is the national CAA's permission processes. They are still in many countries learning these things and doing some things for the first time. So the lead times are longer than they hopefully are when things are moving on more fluently later in the game. And devices design verification, especially for the high risk classes of flights, is not easy, not for EASA or for the device manufacturers. So from their side of view, they are bringing in new features all the time while the regulation is evolving. So the design verification is also for the drone vendors somewhat challenged, but they are more agile in dealing with that. And for researchers, of course, we would like to be running with the latest technology, not 2 or 3 year old technology, especially here where every year brings something new, and devices from 2 years back are absolutely obsolete on the technology and capability and capacity things. So that's when research projects are 1 or 2 or 3 or 4 years, then that becomes a little bit of a challenge. Okay, so The main sort of things ahead of us, probably you are aware of many of this or all of this, but anyways, AiRMOUR and many of our other projects highlighted these things that need to be tackled before activity is operating in scale, whether it's commercial or emergency and medical service concepts. So first of all, the airspace management, very low-level airspace management issues, the strategic and tactical deconfliction when there are more than one drone flying in an airspace, of course, quite key and advancing. Then secure connectivity and general security, whether it's cybersecurity or other kind of security, especially with medical substances. Is a thing still to be solved, and generally gradually moving from designing and researching how to fly to the business model and the value propositions of these devices, whether it's on societal benefits or business benefits. Maybe a European challenge is the research funding from a researcher's point of view. So to mention CESAR is really excellent in covering many technical issues and solution issues in this realm, but less less well aligned to covering societal issues and acceptance issues and even business models and things like that. So we have a little bit of a gap in the funding, but the message is that this will be rectified in the Horizon Europe in the next few months. So maybe that will get better. And one other challenge, once again, a European thing, we have a pan-European legislation and regulation on these things, but still the national implementations may differ. So would be important to create a common market, and if there are differences in the national implementations of the regulations, then the common market might be not as easy to carry out. How am I doing with the time, by the way, Marina? Yeah, okay. So a couple of things still. So back to VTT. This is basically my excellence nodes or group of people's view on what we will be focusing in research, tackle some of these or hopefully parts of all of these in the next few years in our research. So this is just from the VTT perspective, not on the European perspective, on the needs perspective. So our capabilities and also restrictions are highlighted here. But when it comes to the technical and business labor enablers, we are still pretty much working with the mentioned business value chain and also public acceptance, and that the impact issues are still to be developed, and quite a few sort of basic structural things might still be on the development front, but then working really hard already on swarming algorithms and implementing the AI into these drone fleets and many other things. So on the technical and business labors, and there are some milestones there, some relating to civil applications, some maybe to dual use applications, like for example swarms. Well, they are applicable in dual use and civil applications. For example, yesterday we had a first live swarming demo in fire. In forest fire or wildfire conditions in Kuopio in Finland, monitoring and managing the fire with a swarm of drones for the fire department. So that was a nice demo on this. But many things happening in the next few years to make the technology ready to support the society. And as said, we work in projects. So on the top left and the bottom left corners, the project AiRMOUR and $1, they are already completed, but we have plenty of projects ongoing and coming up. Many from the CESAR funding, but also European Defence Fund is a big facilitator for our us advancing our research roadmap. to help Finland and Europe in advancing these. I won't be going into detail, but there are many projects that are ongoing. So basically, I think looking at the clock, I'm now almost at the mark. We lost some minutes in the beginning, but just to conclude. So welcoming questions if there's time for that. But my conclusions here that this AAM, innovative air mobility, whatever you want to call it, is becoming a viable mode of transport in EMS and other applications, and will disrupt some areas, has already disrupted some areas totally. So the thing that I mentioned also earlier, I see that these devices and services have their strengths, but they have also their limitations and even risks. So it's a new tool in the society's toolbox for advancing some services, in many places not replacing the operational and functioning services, but making them better and having more options. So this is the promise of these technologies, and as a researcher, we are not promoting any of this, but we are verifying whether this is true or not in the research projects, and then transparently telling the pluses and minuses and the pros and cons of any application. So basically, that's the content of my presentation. So maybe going a little bit here and a little bit there, but still circling around the AiRMOUR project concept. Thank you.
Thank you very much. A lot of work done in 3 years now, the duration of the project. Incredible. Time for questions. Let's see if somebody online has some remarks.
Thank you very much, Professor. I clipped your contact information, and I'll reach out by email, especially on the swarming for firefighting. Very interested in that. And then also a use case for firefighters. Often those on the line in the wildfire are short on rehabilitation supplies, meaning food and water at the edge. And that would be a handy use case. The last thing is I will ping a conference that I support. There'll be 35,000 firefighters together in April next year, and you would be welcome to attend. There's so much here to share with the community that needs to be seen. So thank you very much for your research. I guess on the questions is there anything on the horizon for more swarm firefighting or other wildland applications?
Well, yeah, I guess I was afraid of this kind of question because, as you can maybe see, I'm a generalist. When we get into the nitty-gritty of things, I turn to my research scientist and ask them. But what I'm hearing from our Kuopio demo yesterday, for example, so what is developing really fast is the AI in for example, recognizing the fire pits where they are and quantifying them in some sense with thermal cameras and video cameras and the sort of combination of the data from those and providing from what I hear a really useful sort of data for the firefighters to and their managers to act upon and that's developing really fast and also maybe the capabilities of the drones themselves to operate quite close to the fire and even within the smoke to some degree and the good thing about the swarming algorithms is that you basically give a rather simple task for the drone fleet, and they themselves as a group decide how to approach the area and how to cover the angles and to get a comprehensive report for the firefighters to act upon. So those are my sort of gut feelings on where this is going at the moment.
Thank you very much. And there's certainly much being done in the spaceborne early detection for fire at scale. and much your tools can bring to bear for those on the line. Thank you very much.
Thank you.
Some other thoughts? I was wondering, you said at one moment that we go from how to fly to why to fly. So that's an interesting concept now, because indeed we slowly have this kind of platforms, but we need to integrate them and see where and how should be placed. So can you comment on that? How is the Europe case? And
Yeah, this is sort of going step by step and in iterative manner. So first we have to solve the how to fly, and then we look into the why to fly, and then adjust the how to fly after that. So basically, there has never been a shortage of use cases for drones, and in some places like media and real estate market and things like that, they have transformed the market to some extent. But when it comes to real life applications operation in scales, then you typically need an operator that makes some sort of business from that, and these are new devices, and the airspace is still not fully managed in any city in Europe, let alone in all cities. So why to fly needs to come back to the benefits, the societal or monetary benefits of what we save, and how we compare to the now used methods for transporting patients or tissues or things like that. So we bring the question back to the cities table, to the EMS operators and actors table to look where and to quantify the benefits, and that's the why to fly, and then we can start looking once again at the fleets and the capacities, numbers of drones, numbers of operators and operation centers, things like that. So this is what I referred to with moving from how to fly to why to fly.
yes, did you also undertake noise measurements, or
we had simulations carried out. Our really good plan was to measure the noise of the big device, and we already created the methods and models for that, and we already purchased the microphones, a set of 16 microphones to measure the overflying sound in different heights. But sadly, we finally, during the beginning parts of 2023, had to abandon the idea of ever flying the big one. So we planned it, but we didn't do that. But there's a separate deliverable still on noise impacts within the deliverable. It's more desktop study and collection of already gathered data than based on our physical flying activities within the project. But an important thing, yes.
wow, interesting. Some other thoughts from audience? So if no other thoughts are, I would like to thank you again for being online and for presenting us your work. Interesting project, many interesting deliverables. So I think we are going to have a look and study them. Thank you very much, and thank you all online. We see next month in October, and I think we can try to go and increase the seeing of the urban air mobility in the future. So thank you very much, everything, and goodbye.
Thanks, and my pleasure, and thanks for inviting me. So anytime.
Thank you also. Thank you for responding.